Hi everyone, my name is Paul Maddinson. I'm the Director for Resilience and Strategy in the NCSC. We all owe a huge debt of gratitude for the extraordinary efforts NHS staff have made to save lives and help us cope with the COVID pandemic. We also have a lot to learn from the last year, including on cybersecurity. Given the immense pressure the NHS was under facing from COVID, we could not afford for it to be disrupted by cybersecurity threats, particularly something as damaging as ransomware. I remember WannaCry vividly, as I'm sure many of you do as well. A similar disruptive attack against the NHS during the pandemic would have been disastrous. This session will look at the coordinated efforts at the regional and national level to defend the NHS from ransomware whilst it was battling the COVID crisis. We are grateful to have a panel of experts with us today who have been closely involved in that effort. Please can you introduce yourselves?
Hello, my name is Ian Mccormack. I'm the Deputy Director for the Government team within our National Resilience Directorate at NCSC. I've got responsibility for our overall relationships with defence, with government and the wider public sector, which of course includes health. And my team and I, we've been working very closely with colleagues across health in support of the overall pandemic response.
Hi, and I'm Karen Dooley. I'm the Deputy Director for Cybersecurity at NHSX, which is a joint unit between the Department of Health and Social Care and NHS England and NHS Improvement, charged with driving digital transformation in the NHS. And my team leads the policy and strategy for cybersecurity across the NHS, as well as compliance and assurance around cyber.
Good afternoon, everybody. I'm Neil Bennett. I'm CISO at NHS Digital. So if you're not familiar with NHS Digital, we are essentially the technology, data and digital delivery arm of the Department of Health and Social Care. We design, build and run a portfolio of services that support the NHS and social care, ranging from national infrastructure to clinical services. through to patient-facing services such as the NHS UK website or the NHS app. And within that broader remit, we also deliver a number of national-scale cybersecurity services, and we support local organisations in improving their cybersecurity posture. We've also been very much at the front and centre of delivering and securing the testing, the digital infrastructure to support the testing programme in response to COVID, and more recently delivering and securing the digital infrastructure to support the vaccinations programme.
Stephen, we can't actually hear you.
I'm also the chair of a digital board that represents a collective of healthcare partners in Birmingham and Solihull. And last but not least, I chair the West Midlands Regional Shared Care Record Board. Pleased to meet you all. Thank you.
Thank you all for joining us today. Stephen, if it's okay, I'll start with you. You were in an NHS trust when the COVID first wave hit. How did it feel?
Well, I think, if I have to be honest, we were running on adrenaline. You know, we were faced with some specific challenges in terms of, in particular, how we were going to mobilise services for very large volumes of people to shift away from a sort of typical office environment or working environment to work from home. Clearly, that in itself presented some what I describe as logistical challenges. But interestingly enough for me, my organisation was also responsible for establishment of one of the Nightingale centres, the one that was based at the NEC in Birmingham. So I had a team that was working 24/7, literally, over a relatively short period of time to deliver all the digital equipment that was required to establish that as a working facility in a small scale of time. But I'm pleased to say that we achieved that. And not just due to the people working in University Hospitals Birmingham, but for the many people in the local health economy and wider that supported us in that goal. What I would say is that it was quite interesting. You know, I think many of those things that we had to do were established. What wasn't done previously was delivering in the time scale and at the scale that we're expected to do, A, to support the Nightingale, and B, support a shift of a majority of the workforce to working from home and remotely as opposed to working in a hospital complex.
Yeah, so a really fantastic effort, as well as changing the way we worked, and which affected many of us, of course. COVID also changed some of the cyber threats that we saw as the NCSC. Ian, can you tell us what happened to the cyber threat, particularly as it relates to the NHS?
Yeah, absolutely. I mean, COVID, it's changed everything about our lives. It's changed how we work. It's changed how we live. It's changed how we interact with health services. Now, the cyber criminals out there, the threat actors, they will aim to exploit whatever they can that can enable them to earn money. And all of those factors that are associated with the changes of how we live and how we work are things that could present an opportunity for cyber criminals. I think for the NHS, ransomware probably remains one of our biggest concerns. It's pervasive, and criminal actors will use it as will use any factor as a reliever of pressure to encourage ransom payments. And this is, there's been numerous ransomware incidents around the world that affected healthcare organisations in the US and France, for example, and that shows that the health sector is, certainly not immune to that. To that threat, and it also reinforces why it's so important to put in place the measures that you'd find in our guidance on mitigating ransomware. And then for the citizen, the COVID pandemic has presented lots of opportunities for cyber criminals to develop, if like, lures to try and get people to fall for some of the scams. Typically, the aims of those would be to harvest personal information for gain, or maybe direct financial gain. And then finally, looking a little bit beyond the cyber criminals seeking profit. We've also seen some activity with advanced actors globally targeting the overall vaccine development effort, and the UK, alongside allies, has attributed some of that activity to Russian advanced threat actor groups.
And we're focusing on ransomware, obviously, in this session, but ransomware threats have changed quite significantly over the last couple of years. In what ways have they changed?
Well, everybody probably remembers back to 2017 and the WannaCry attack that had a really significant effect on the NHS. But WannaCry wasn't it wasn't deliberately targeted. It wasn't targeted specifically at the NHS. It exploited a wormable vulnerability in SMB, which meant that it spread very rapidly and in quite an uncontrolled fashion. And at the time, the NHS was especially affected due to the reliance on legacy technology and some of the services that it provides. But in terms of some of the evolution since that period of time, ransomware packages have got much more sophisticated, and ransomware is becoming much slicker in terms of how it's developed. And in particular, the techniques and tradecraft that we've seen used has evolved, and we've seen particular sectors such as education become a particular focus for attacks more recently.
Thank you. And if that's a threat that the NHS was facing, Karen, if I can turn to you, clearly the operational pressure on the NHS was huge responding to the pandemic. How did you ensure that cybersecurity and threats like ransomware were considered as part of the conversation?
So I suppose at a national level, that was really easy for us because, it was immediately obvious to all of us working in this space that, any ransomware on even one hospital trust could be devastating at that point in time, let alone multiple ones. So I think even before COVID-19 really took a hold, I'd say Cabinet Office, the NCSC, NHS Digital were in the room with us, with NHSX, talking about, where the greatest vulnerabilities were across the NHS and what it was that we might need to do differently to build some rapid resilience. I think when I think about having that conversation with local organisations, obviously it was trickier because they were just drowning under this weight of operational pressure at the time, and any kind of broad call to action around come on guys, let's improve your cyber resilience, you really need to up your game, was just going to get drowned out in all the noise. So we really needed to think about how we had very specific and targeted conversations with the right people at the right time. So one of the things we did from the centre was start to look at which were the most critical organisations across the NHS that we needed to work with. So for us, they were, the major trauma centres, the ambulance trusts, and organisations like Stevens, who were trying to rapidly set up these Nightingale centres at pace, as well as looking at what data we had at the centre that allowed us to identify which organisations, due to their current cyber posture, were most likely to be at greatest risk. And then, having that information available to us allowed us to work through our regional teams who knew the people on their patches and they knew the kind of local pressures people were under. And we sort of then routed that conversation about targeted vulnerability and risk through those individuals so we could get to the right people to have the right conversation at the right time.
Yeah, thank you. And given that threat of ransomware, Neil, so what were the vulnerabilities that you were most concerned about across the NHS networks?
So I guess just to give a bit of kind of context to that question, the NHS is a very complex system. It's a set of separate individual organisations, all of whom are responsible for their own cybersecurity, and they can and do make local decisions that can be based on risk appetites, availability of funding, and the various other considerations at a local level. And the result of that is an amount of variability in terms of maturity and security posture across the system. So at a macro level, that complexity kind of means that things like tech debt, legacy systems, and issues such as unsupported software or trying to keep software within support are all kind of themes and general areas of concern. But I guess delving down into a more specific level within NHS Digital and working closely with NHSX and NCSC, we operate a high severity alerts process So we will review and triage vulnerabilities from various sources of intelligence, and where we believe that those vulnerabilities are particularly critical and particularly applicable to the context of the NHS, we will push out alerts advising organisations to take action to remediate and putting some timescales around that remediation activity. And a couple of the particular vulnerabilities that we've pushed out in recent times during that COVID period, the Windows TCP/IP vulnerability and some of the Exchange vulnerabilities that we've seen recently have been particular areas where we have encouraged organisations to move at pace to remediate, and where necessary we've supported those local organisations to ensure that they are remediated swiftly given the concern around those vulnerabilities.
And looking at backups in particular, given the importance of appropriate backup as a strategy to prepare for a ransomware threat, how did you work together both at the national level and with those local organisations to ensure that there was a consistent and high standard approach to that issue?
Yeah, so I think, taking some of the lessons from organisations that have been impacted by ransomware attacks, and also based on the advice that was given to us by NCSC very early in the pandemic, backups was a very key area of focus for us. Working with colleagues in NHSX and NCSC, as Karen's kind of touched on, there was some work done to place the trusts into cohorts based on criticality to the pandemic response, and based on the risk that we viewed those trusts as running with. And those cohorts enabled us to prioritise the support, and running through those cohorts, we provided support to those individual trusts in reviewing their backup. So very much aligned to the NCSC backup guidance, would perform a review against that guidance, and then the resultant findings, we would either support those organisations with remediating against those recommendations, or in some cases, NHSX actually funded new backup solutions, ideally cloud-based backup solutions. So it was a combination of either kind of boots on the ground support, if you like, to help organisations get the backup provision to where it needed to be, or supporting them with funding to get a new backup solution in place, just to ensure that we had that kind of stable backup position right across the system.
Thank you. And Stephen, what was it like being in a trust and the support you received?
Well, I have to be honest, the attention that you receive is welcome. And what I mean by that, just listening to Karen's comments earlier, it made me smile. I think we always welcome a critical eye. We do rely on some subject matter experts that are embedded within the organisation. But if there's one thing that will massively help with demonstrating confidence in the approach, is to actually ask external organisations to come in and look over what you've done in the approach and your policy and your configuration, etc. Because undoubtedly, something will come out of that is useful to pick up almost as an educational process, that you pick up as part of the learning that you deploy into your processes, that fingers crossed will enhance your ability to be resilient in the event of an issue.
And Karen, part of your role in NHSX is to hold NHS organisations to account for their cybersecurity. So you were there to look at the reporting and the accountability. How did that work during the crisis? Did you have to change the way you approached it?
So yeah, I think last year was the third year of our cyber programme following WannaCry. And it was, up until then, we'd very much focused on support and interventions into the sector and building up NHSD's capabilities. And last year was really meant to be the year that we started to shift away from that, giving a helping hand, and moving very much more towards us like strengthening the compliance and assurance model, and really shifting the emphasis onto local organisations to take responsibility for cybersecurity and to kind of bring their organisations to compliance. Now, clearly at that point in time, back in March, if we sort of started to then wield a great big stick, it was not going to be of any help to anyone. And that was immediately obvious to us. So, we really did have to pretty much turn our approach on its head. And as Neil's described, start to think about what were the things that where could we have greatest impact by doing things that kind of wrapped our arms around organisations from the centre to give them support. So we did some of the work around vulnerability scanning, which helped identify, the greatest risks out there that we could then contact organisations directly through NHSD to, get those fixed quickly. We worked with NHSD and the NCSC as well, very much reached in to NHSD to build NHSD's security operations capability and capacity so that they had much greater bandwidth and expertise to do more in that space around monitoring. And we also we commissioned cyber incident response capability. So the level at which in normal times we would intervene with incident response capability is relatively high. But we took a conscious decision to really lower that bar so that, the slightest sign of any issues in any NHS organisations, we were able to put boots on the ground immediately, find out what was wrong and prevent that from escalating further any further. So, I think that combined with the boots on the ground approach that Neil's described around backups, very much turned on its head the way that we approached last year in terms of compliance. Although I would say, we were, for a lot of the work that we did with Nightingale House in particular was running things like pen test. And, we did very much look at, what came out of those and then worked with the organisations to make sure that they both had the capacity and capability to remediate significant issues, but also that those things were actually taken forward.
Yes, it's an interesting sort of question, the balance between sort of regulation and compliance and support and assistance in trying to incentivise improvements in cybersecurity. We have a similar conversation with critical national infrastructure operators at the same time, and clearly, throughout this period, support and assistance was more important than necessary compliance, I suppose. Although setting the standards and making sure that people are clear what good looks like is also really important, isn't it? So Ian, sorry, come back, Karen, if you'd like to.
I was just going to say, I think it felt very much like being on a tightrope last year, like constantly trying to find that sweet spot between compliance activity and making sure that we didn't overburden organisations or inadvertently create operational risks. So I think Stephen will probably remember right at the outset, we took a conscious decision to allow organisations 6 months leeway on submitting their annual self-assessment against a cybersecurity standard. And, it was a really tough decision because we had to think, well, on the one hand, this sends a message that, perhaps cybersecurity is not as important and, we're willing to give organisations 6 months longer. But actually, when we looked at it and we thought, well, organisations are 2 weeks away from submitting this self-assessment. And in reality, for the vast majority of them, the real work has already been done. You can't possibly achieve everything in that final 2 weeks of the year. So, in all practical sense, those organisations would have been, wouldn't have been less compliant or resilient by us increasing that deadline. So, but the tough decisions all year on where to draw the line, I think.
Yeah, some really fine balance decisions to take. And also, I mean, presumably you're trying to encourage a sort of openness and transparency, so people are willing to share and to learn from what happens in different areas, and that way encouraging everybody to get better. On a different track, Ian, what other support did NCSC supply to the NHS during this period?
Thanks. Yeah, I mean, obviously, when the pandemic hit, support to public health became one of our very top priorities within the NCSE, and that was support into NHS Digital, NHSX, but also support to the public health authorities and the devolved administrations of the UK as well. So it's really quite broad-reaching. We spent a lot of time and effort working with Karen and Neil and colleagues on some of the things that you've described there, Karen, to help build some of that capacity and that resilience into the overall health sector, into the overall health enterprise. There's actually some really good stats, I think, that illustrate some of what you've just been describing there, Karen. We've provided threat hunting support covering over 1.4 million NHS endpoints. We scanned over 1 million NHS IP addresses, and I think you mentioned there, Karen, we discovered 160 critical vulnerabilities in NHS systems, which we were then able to have addressed locally, and supported organisations doing that. And probably something actually that I mentioned that's quite important for us is in October, we onboarded the Health and Social Care Network to our protective DNS service. And that service, it prevents users from accessing known malicious domains and can prevent malware from reaching the command and control infrastructure that it relies on. And as part of that onboarding, we've brought on board over 1,000 healthcare organisations, which actually pretty much doubled the size of our PDNS service.
And support to things like the contact tracing app in the early days of the pandemic, and then more latterly sort of the test and trace programs. How was that?
Yeah, I remember it well. I was involved with a team that got called down to London to get involved in the test and trace app development right in those early days. And the thing is, around the organisation that was set up to do that, the number one priority was breaking those chains of transmission. So that's what we had to support. And we very much took a role of how can we ensure that this app is appropriately secure, that it protects privacy, but importantly, we don't lose sight of the real need to break those chains of transmissions. And we position security very much as if people don't trust the app, if people don't trust that their privacy is going to be protected, then they won't use it and it won't have that public health outcome. So we very much had that focus. We lent in very heavily, providing expert security architectural advice and assistance into the actual design of the app itself. And we're also quite fortunate in NCSE. We've got access to a number of really awesome technologists. So we use, for example, some of our experts in RF transmission to really understand some of the properties on some of the characteristics of Bluetooth transmission, so that we could help do the modelling around the distance and time that's so essential if you can use Bluetooth to do that determination. So we've been really fully involved in the development of the app process. And then, of course, as you mentioned, the wider test and trace piece we've been involved with. We've been involved with the whole programme throughout the period. We've helped give security expert advice into the various different services that have been built up, and that's ongoing today. We've provided a lot of assistance as well into the development of the test and trace monitoring capability.
And Neil, from your perspective, a lot of new digital services needed to be stood up very quickly, presumably around the vaccination programme more than anything else. I mean, how was that, and how did you ensure that cybersecurity and resilience was built in when you're trying to do something so rapid?
Yeah, I think that's very much been the case for both, our existing services that were out supporting the health and care system and citizen-facing services. The demand for those services was significantly increased in the early phase of the pandemic, and then the delivery of the test services to support test and trace, and as you've touched on more recently, the vaccination services. So the vaccination services have been a combination really of some of our existing digital services that we had in place within NHS Digital, some existing services that we've had to enhance at pace in order to support those user journeys for vaccinations, and then some new services that we've pretty much built from ground up and needed to be delivered at pace. So it's very much been a case of getting security experts from within NHS Digital and supported by NCSE where appropriate in those delivery teams right from the early stages of the design, get the security built in from the design right up front. And I've had teams embedded within the delivery teams to both provide that kind of secure by design input and also provide assurance over the existing services and the changes to services that need to be introduced in order to support those user journeys for the vaccination services. There's in excess of 20 services in those end-to-end journeys for the vaccination services, so it's quite a complex environment. So very much get the security experts in up front, but we've also worked at pace to bring those services under our protective monitoring within our national SOCs. Some of the services were already under protective monitoring, but where we've had to enhance some services or where we've had to build some new services from ground up, we've had to accelerate the pace at which we could bring those services under that protective monitoring capability to ensure that they can be appropriately secured and support that vaccination programme.
It's been a fantastic success, and huge gratitude from all of us, I'm sure, for everyone involved. And Stephen, at the more local level, you talked about the changes to the way that people were working, and the way healthcare is now delivered has changed rapidly over the last year with remote consultations and a lot more online sort of logistics. How have you managed to incorporate cybersecurity into that big change at the local level?
Well, I think, to be honest, and I use the words really carefully here, is that to some extent what happened on the back of the pandemic has really seen an acceleration of transformative capability in terms of the way the NHS was going to deliver services to patients. What it's really done is it's accelerated that work that had already started. And I think in part, especially in a primary care setting where you had vast numbers of GP surgeries that fundamentally just shut down, but wanted to continue to deliver care to patients. So largely they shifted to a model where they were providing advice and guidance and consultation, often from a home setting or some form of remote setting. But actually, that has stood up well and has been well received. And I think we'll see not a return to as it was before, but a greater adoption of those remote services that to some extent can be of greater efficiency. But of course, what comes along with that is the need for there to be greater, education and awareness. It's the big challenge that we have in terms of how do you educate not only your staff but the public in terms of the risks around cyber. How do you ensure that you've got the consistency in the controls and the technical controls that you have in place to make sure that they're effective? How do you get that externally examined, so ensuring that you're not marking your own homework? How do you ensure that things such as your policies are up to date and applicable? So what came with it really was not only an acceleration of transformative capability in the way the NHS delivers services to patients, but came a big responsibility in terms of making sure that the collateral that needs to support that is appropriate, is fit for purpose, is well understood, and that you're not leaving yourself any holes or gaps in that.
Yeah, and of course, standing that all up at speed. But now as we're moving forward and hopefully things are opening up, what do you think, all of you actually, your views on the future for cybersecurity in the NHS? Which bits do you think we'll take forward? Which bits do you think we'll need to look back on and reflect and think, actually, in slower time, we need to go back and rebuild that? Stephen, do you want to go there?
Yeah, if you don't mind, I think, in reflection, it goes all the way back to WannaCry and issues that have manifested since then. I think we continue to see an appetite for there to be investment. I think we continue to see a desire to develop skills and competencies. I think we definitely have seen a shift towards collaborative responsibility around cyber. So I work in a healthcare system that has a number of organisations that individually have people that look after or support cyber capability. But there's a recognition that so much more could be done if we pulled that resource and that investment. And certainly I'm leading that as an initiative within the system that I work. And I think we will see more of that. I think we will see greater partnerships and relationships with those specialist vendors and companies that can offer additional services and capability to give you the confidence. And I think we'll probably start to see some consistency in the approach that individual organisations take in terms of their cyber stance. At the moment, it's open to interpretation, and several different people can read different things into a policy or an approach. And I think actually one of the things we need to do to enhance our capability is to bring some alignment to that. And again, I think we'll start to see much more of that in the near future.
And Karen, Stephen, what does it look like at the national level?
So undoubtedly, the rapid digital transformation that's happened across the NHS, it's massively widened the attack surface out there. So I think we need a period now of consolidation around going back and understanding, how that changes any of our plans going forward, and where we might need to change our approach in some respects to kind of go back and address some of the potential security debt that's been created through that rapid transformation. This year really is going to be about us focusing on levelling up all organisations to a baseline cybersecurity standard, and then very much focusing on how do we transfer that and make sure that the responsibilities and accountabilities for cybersecurity are well understood and taken forward by the right organisations and the right individuals and leaders across the system. So that'll be a big focus. We had a fantastic relationship, I think, anyway, across NHS Digital and the National Cybersecurity Centre before this, but it does feel very much now that we're like a tripartite of organisations that will continue to work really, really closely together. It's very clear that we've got very distinct and separate roles, but that working together you can achieve so much more so quickly. So I see my colleagues on the screen here, 2 or 3 times a week, some weeks, sometimes more. And I think that will very much continue as we go forward, and, continue to take forward a lot of the NCSC products and services like protective DNS, which have just, become game changers for us. As we go forward. Stephen, sorry, you wanted to interject.
No, I completely agree, and forgive me for raising a hand. The one thing that I did want to throw in there is the responsibility also extends to our supplier community.
Yes.
I think if one thing that WannaCry did was highlight I'll use that phrase, use my words carefully, sometimes the lack of an approach that vendors will take to their cyber stance or their ability for their products to withstand attack. And I think there is still, unfortunately, more needs to be done in that space to ensure that our vendors also play their part in terms of the goods and the services, especially in the digital spectrum, that are robust in terms of aligning to cyber standards, because I still think there are some issues there that hopefully will get addressed.
And that is a key priority for NHSX in this year. Ian, did you want to interject as well?
Look, Karen, I just wanted to say it's really great to hear you say that about the strength of the relationship. I'd certainly echo it from our side as well. That's brilliant. I think for me, there's a couple of things I'll just sort of draw out there, and I absolutely agree that we need to get the foundational security consistently and routinely in place across everything we do. It's really important. I mentioned earlier, I still think ransomware is the biggest thing in terms of a threat sort of space to worry about. So we need to get that. We need to get that right. That includes the consolidation of all of the monitoring that Neil's talked about as well. But there's probably something else as well to think about going forward. And there's some lessons that perhaps coming out of the some of the test and trace services as we develop much more, if you like, sort of like data-driven approaches to health services, and we're starting to provide national scale services out to the citizen with all of the data that goes with that. We need to make sure that we're doing that in a way that's really privacy protecting at all times, and that we've got that that really strong sort of data security sort of wrapper around it as well. So we really need to think about both of those things, getting that foundations right routinely and robustly, and then how we protect those new generations of new services that are going to come over the horizon, I'm sure.
Yes, thank you. Neil, would you like to come in?
So I think my colleagues have covered it pretty comprehensively, but I think the only other thing that I was going to add was, I think, cybersecurity has kind of been bumped up the agenda and got quite a bit of focus in a number of areas over the last 12 months, but it's an area that we do need to continually focus in terms of getting that consistent understanding of cybersecurity being an operational risk and a clinical safety risk at the leadership level right across the system, and that's something that we really need to focus on over the next 12 months or so. There is the dealing with the security debt and looking at it from the technical perspective, but absolutely getting that kind of leadership focus and getting the understanding around clinical risk and operational risk, and not just the technology risk, is critical to us, really.
Yeah, very much. And Stephen, you flagged the supply chain issue, and obviously that's a threat that we've talked a lot about today, and is very much in people's minds, particularly following the SolarWinds incidents. So what does the supply chain threat look like to the health sector? Any volunteers for addressing that one?
Well, if I may just respond to that quickly and as coherently as I can, I think and to some extent this is already there, so don't misread too much into it, but requires strengthening is probably the phrase that I'd use, and I'm sure Karen and my other colleagues here would appreciate this, is that contractually we need to strengthen our position to ensure that our suppliers meet their obligations in this space. I think historically it's been weak. It has improved, and it did improve after WannaCry. More work yet to be done in that space, and I also think there's probably a commitment, going back to this, we've used this phrase a couple of times today, around the sort of security and technical debt. Well, more needs to be done to ensure that organisations aren't finding themselves holding that security or technical debt. And unfortunately, the only way that that's going to come is probably with a bit of a stick and carrot approach in terms of persuading them to respond to that.
Ian Levy this morning, our technical director, talked a lot about the buying power of government and how that can be used to influence particularly supply chain threats. Is that something the NHS might be looking at?
Yeah, absolutely. It's on, we will be having those high level strategic conversations with vendors across the that supply the NHS about, what leverage we can use with those vendors to help make sure that, they're both complying with standards, but also having that lifetime management of devices as well, and making sure that, organisations are able to patch those and keep those securely up to date for their lifetime.
And you mentioned patching. I mean, obviously that was one of the issues for many organisations. How is the NHS's policy around that now, and your ability to manage critical vulnerabilities?
So if I think back to WannaCry, I mean, the NHS had been warned about Eternal Blue, 4 weeks before WannaCry hit, and provided with the patch, and those organisations that were on supported versions of Windows could have protected themselves. But at that point in time, we had no means of knowing whether or not organisations had even got the message and received the patch, let alone whether or not they'd implemented it. So within a few months of WannaCry, probably weeks even, we worked with NHSD to create a kind of tactical solution whereby we had that feedback loop that organisations had received the message. And over time, we've really built on that, working with NHSD. So I think around, within a year, we started not only to get the message back that organisations had received the message within 48 hours, but also that they were acting upon it, and that they'd actually either patched or otherwise mitigated the risk within 14 days. And I think in this last year, because in some ways, as I've described, some of our compliance measures, we've kind of taken a little bit of a step back on patching, because it is so critical to make sure that, when there's high severity vulnerabilities out there, that they are addressed and patched quickly. That's an area where we haven't taken our foot off the gas. In fact, we've probably gone the other way, in that now we not only want information back that organisations have received the message within 48 hours. We want information back that they've acted on it, and we now start to also look at, what is the information that's coming back, and how are we happy with that? And where organisations aren't patching quickly enough or providing sufficient assurance that they're in a safe place, we now work very intensively with them to make sure that we have that assurance. So I think, over time, it wasn't a big bang change. It is, very much evolved over time, but I think we are in a very different place. I think we're in a relatively good place in terms of, being, now being able to, when these, key vulnerabilities come up, we do then know what's happening, and I think that's a key thing. When you've no idea what the actual situation is, that becomes really difficult. But then we now know where it is that we need to point our guns and provide our support.
And Neil, from your perspective, how is that all working? You mentioned the Microsoft Exchange vulnerability. How did that work for NHS?
So that was one of the vulnerabilities that we identified through triage that needed some real pace of remediation. So we pretty immediately invoked the high severity alert process that Karen's just touched on there, and pushed that alert out across the health and care system. So that alert will be received by organisations. It gives some detail on the vulnerability, the Exchange versions that would be impacted by that vulnerability, and the remediation action that's required. The Exchange vulnerabilities, I think, because they did get an amount of kind of trade coverage, press coverage, it was helpful in a way because it did kind of raise the focus across the system on getting that remediation activity completed. But we were quite concerned about those vulnerabilities. So we were very actively working with NHSX regional leads out across the system and local organisations to ensure that any issues with remediation, we could support those local organisations, and just kind of continually maintaining that communication at a local level to ensure that the remediation activity was carried out at real pace. And I think that's probably one of the fastest kind of turnaround in terms of full remediation across the health and care system that we've seen in response to the high sev alerts that we've pushed out, actually.
Yeah, fantastic. We heard earlier how some of the NCSC's ACD services helped identify where these vulnerabilities were and whether people had taken action. Was that helpful for you, or were you on it already and you were quicker than us?
No, it was indeed helpful. So I think in terms of the visibility that we've got across the system now, a combination of the NCSC capabilities and things like ATP that we have visibility of within our SOC. We've got about 1.5 million devices across the health and care system now covered by ATP. So a combination of the visibility that we get within our CSOC and the visibility that's available to NCSC, a combination of those things is a massive step forward in terms of being able to get that kind of real-time true picture of vulnerability and progress being made across the system in remediating those vulnerabilities, so that we can target where we need to engage more closely with organisations and target where we may be able to provide some more support to local organisations. Having that visibility is a big win for us.
Thank you. That's really impressive. Not least because obviously that was right in the middle of this latest wave that we've just got through in COVID. So very impressive for you to be able to respond like that in a way that many organisations haven't yet got the capacity to do, even though the NHS was under so much pressure. I think that's probably about all we've got time for now. But just wanted to thank you all as a panel for contributing today and sharing your experiences, and to say again, how grateful we are for all the work you've done to protect the NHS from cyber threats, whilst it was saving lives during the pandemic. The way you described the importance of national, local and regional coordination, I think really resonates with us, and we talk a lot about team cyber and how this is a team sport, and you've certainly demonstrated that in action. So thank you very much. We're also at the end of the day for CYBERUK, and what a day it has been. We've had thousands of people signing into our sessions on YouTube and hundreds reviewing our on-demand content. I'd like to thank everybody who has been involved, particularly our speakers, Jeremy Fleming, Director of GCHQ, Sudhakar Ramakrishna, CEO of SolarWinds, and Priti Patel, the Home Secretary. We've had some great panel discussions like this last one on a number of key cybersecurity issues, so thank you to all of our panellists. And thank you to all who have joined us today. If you have missed anything, then please look at our YouTube channel where you can be able to catch up on a lot of today's sessions. Well, we're only halfway through CYBERUK, and we have a great day scheduled for tomorrow. The Foreign Secretary, Dominic Raab, will present our keynote speech. We have a discussion with Anne Neuberger, the Deputy National Security Advisor in the US, Beth Seisland, the Deputy National Security Advisor for the UK, and Lindy Cameron, the NCSC CEO. We also have a number of great panel discussions, including a closing session on emerging cyber trends. So thank you for joining us today, and we look forward to seeing you tomorrow. Thank you.